Welcome back to Different Facets of Happiness. I'm Jackie Denise, and today I'm joined by Eileen Kopsaftis, a physical therapist, pain expert, and founder of Have Lifelong Wellbeing. With over 30 years of experience, she helps people uncover the root causes of pain and redefine what it means to age well. Eileen Kopsaftis, up next. So, Kopsaftis, you know, I
Very good.
I practiced for a couple of days and I said, do not mess this up, Jackie. So, welcome to the show. And for those meeting you for the first time, what exactly does a pain consultant, movement expert, and nutrition educator do?
Oh, wow. Well, a lot of different things. I wear a lot of different hats, but
Yes.
my focus is to get people out of pain and to help them to age well so that they can eliminate the fear of ending up in a nursing home. So I'm really all about erasing pain and empowering people because the human body is really not designed to age on a cellular level. All the things that we've been fed with the mainstream narratives are kind of lies from the pit of hell. So
Yeah.
I kind of feel like I set people free, if
You
you
do.
want to put it that way. Yeah. Yeah.
You set people free and you inform and educate people about what they can do. So because you spent over 30 years in this field.
Yeah.
What
Over 30, 32
over
now, I think.
Yeah,
Yeah.
yeah, that's fascinating. So what originally drew you to helping people resolve pain instead of just managing it?
Mm. So, right away when I started in my profession, we had someone come as a guest speaker when I was still in college, sitting there, in the 3-hour courses, learning how to take notes as quick as I could, and then having to transcribe them when I got home because I wouldn't have been able to read them the next day.
Yes.
And we had this speaker. She was amazing. And she talked about the power of what she had learned to do as a licensed physical therapist with manual training. And people don't know this, but PTs can be extremely different in their skills and their knowledge and their experience. So, one PT might focus on hands, another one wheelchair fitting, another one, low back or geriatrics or pediatrics or whatever. And then we all graduate, no matter whether it's, I'm a dinosaur. I graduated with a bachelor's degree. A couple years later, it was a master's, and now it's a doctorate. But we still graduate with this entry level knowledge. And then it's really where we focus after that.
Yeah.
And I invested more time and resources into my education after I earned my degree because I was really passionate and determined to learn what would work to help people. And there's a lot of conventional treatment out there that really doesn't work. And
Yes.
when this woman spoke, I was so inspired. And I was completing my last clinical affiliation that you had to do before you could take your licensure exam. And I worked in a clinic with a couple of women. They were business partners. And they took a course from this woman who had spoken at the college course.
Yeah.
And they were walking on air because the effect it was having on their patients was just phenomenal. And they said, when you get licensed, you have to take coursework from this woman. Well, I did more than that. I called her and I said, I want you to tell me
Mhm.
what, because she had a waiting list because physicians would only send people to her because her work was so effective. And I said, I want you to tell me, where should I go to learn coursework and where should I not? Because I don't want to waste my time or my
Right.
resources. And she was amazing. We became close friends. We traveled everywhere to take coursework together. She became my mentor and close friend many years. And I learned so much. And the more I learned, the more people I could help. I mean, it was effective. I did get physicians sending people to me specifically because of the success of the work. Now, here's the thing,
Yeah.
that was the first 15 years of my profession. The last 15 years, or 17 now, is I learned that I can only help so many people by putting my hands on them because it's one on one and it's time consuming. And I have come across methods and trainings and strategies from the most brilliant people on the planet. I don't claim to be brilliant. I'm just really gifted at finding brilliant people. And so the training that I've had the last 17 years has allowed me to teach people how to fix themselves. So I'm teaching them how to fish now instead of handing them the fish.
Yeah.
And I am so gratified, and I'm like the luckiest person in the world because the people I work with get better. Now, am I 100% successful 100% of the time? No. but got a pretty high success rate. I have an online academy. I call them my students, but they're
Yeah.
they're over 50. Some of them are in their 70s and 80s, and we do a live class every week, and I teach them movement. There's a lot of stuff in the academy for them to learn about other aspects of health and life. And I feel like I'm in a love bubble because they're so amazing. They're thankful, they're grateful, they're encouraging to each other, they support each other. It's just the most amazing atmosphere. I attended some course a couple of weeks ago and people were ripping the speaker up the back. And
Yeah.
I'm like, wow, I'm like cushioned in this love bubble in my world because I don't get that. Oh,
Well, let me ask you something because you say that pain is not a normal part of aging. So
no.
why have we collectively accepted that belief?
It's the mainstream narrative. It's everywhere you hear it, everywhere you go, you're going to get the same mindset. You're going to get it from healthcare professionals. You're going to get it from movement professionals. You're going to get it. So, what happens is people are treated according to the number of candles on their birthday cake. They're not treated according to their ability.
This is true. This is true. Yeah.
So, and I've worked I don't claim to know it all, but I've kind of seen it all because I've worked in nursing home settings, long-term rehab, orthopedic outpatient. I've worked with teenage athletes. I've worked in pediatrics. I've done acute hospital care. So I've kind of seen it all. And what I've seen is even my colleagues, they'll treat people based on their age. And so I had a patient, and this is a perfect example.
Yeah.
I had a patient in a nursing home setting. She was there for long-term rehab, well, short-term rehab, because she had broken her hip. Now, she was 86 years old. She had broken her hip. She was in there because she lived alone and she needed to help until she recovered and could go home.
Hmm.
My colleague gave her these exercises where, you're doing all this nonsense sitting in a chair. Now, I don't mean to be disrespectful, but it's nonsense. This woman had slipped on a ladder when she was cleaning snow off her roof. Do you think chair exercises was going to equip her to go home and do what she was doing? She was a woman who lived on a farm and she worked her butt off.
And sorry, you said she was how old?
86.
Wow.
Now, anybody can slip on a ladder in the snow, they
Yeah.
get slippery. So it wasn't her age that caused her to fall. And she was going home to do the same thing she had done prior to that injury. So I gave her work. I gave her, lunges and squats and things that were going to help her. So it's we you're going to hear from physicians and even people in my profession, well, what do you expect at your age?
Yes.
Well, you are 72, and it's nonsense. It's not true. I mean, I'm 67. I don't have pain. I don't even have Tylenol in my medicine chest, and I'm not an anomaly. I'm not an outlier. I just know what to do, and I don't believe the lies that mainstream media and all the rest of the people want to put on me. I reject those lies.
So why does treating body parts in isolation often fail to solve the long-term pain?
Mm. Because we don't move our bodies or use our bodies in isolation. So, and here's a perfect example.
Yeah.
When somebody wants to get stronger arms, they're gonna want to work their biceps, or they're gonna want to work their triceps, and they're gonna do movements that are not authentic or natural. And what I mean by that is, if you go to pick up a heavy bag of groceries off the kitchen table,
Hmm.
you're gonna do a little squat down to set your power source, which is max, gluteus maximus. So you're going to squat down, you're going to grab the bag, and you're going to push through your feet to lift that bag up.
Right.
You're not going to say, oh, I'm going to make sure I keep my elbows at 90 degrees. I better make sure I only use my biceps. Maybe I'll supinate a little as I pick up this bag. No, we don't do that. The same thing with triceps. When we go to do the triceps, I better make sure I keep that elbow in. I better only use my tricep. Well, if you go to put a heavy bag in the overhead compartment on an airplane,
Yeah.
again, you're doing a little squat. You're pushing through your feet. You're using your whole body because it's this physics thing. For every action, an equal and opposite reaction is required. So it's kind of crazy. We train our bodies like dead people because we're training them based on the anatomy study of a cadaver. And it's not how our bodies work in real life. So, they've studied cadavers for centuries.
Yes.
And this is where the muscle attaches. And if the muscle shortens, this is how the body moves. So that's how we're going to train that muscle. We're going to get that muscle stronger and bigger and hypertrophy. And it's not how the body works. The body's scratching its head going, "Why are you doing this? This isn't this." And so you're setting people up for tendonitis, tendinosis, tendinopathy.
Yeah.
I've had tons of people come to the clinic who spent an hour a day in the gym, after work, before work, and they had tendonitis because 'cause they're isolating muscles in a very inauthentic way, and their body's not happy about it.
So, and I also hear fear as well. So, do you believe fear plays a role in how long people stay in pain?
Yes, people are afraid to move, and lack of movement is the worst thing we can do. As a matter of fact, on my YouTube channel, I just started doing a little 5 video series. My Friday value videos are like 5 minutes long. And I started the 5 lies that will keep you in pain and prevent you from aging well. And the first one I started with was you figure if it hurts to move, you just stop moving.
Right. Yes.
And then it'll heal, it'll go away. The human body is designed to move. Lack of movement is the worst thing we can do. Now, of course, you need to make sure you're safe. If you've got a fracture, you don't want to put weight on it. There's some common sense things. However, movement can actually heal pain. You just need to know how to do it the right way. And that's what I teach.
So, then how much of chronic pain is physical versus behavioral patterns that we've repeated for years?
Mm. Chronic pain, it's multifaceted. Each person I say, everyone's very unique, like a fingerprint. I kind of joke and say we're all a bunch of snowflakes. So, and that's why evidence based medicine will never really be effective for pain because we're all so unique. We've got different histories, different intake of nutrition over our lifetime, injuries, accidents, surgeries, medical diagnoses, medications. So sometimes a medication causes chronic pain. I mean, in my book, Pain Culprits, I've got a whole chapter on the things that can create pain. And you're chasing your tail, but you got to talk to your doctor and change your prescription because that's what's doing it.
But are,
So
are
there's
we
a,
over medicalizing the pain?
oh, absolutely. Because we're seeing people as a body part, not as a whole. And that word gestalt, the whole is more than the sum of its parts.
Yes.
We
Yeah.
don't take a body part off and put it on a shelf when we go to bed. Everything's connected to everything else. And I've resolved chronic pain in people by fixing ankle function. And they had chronic pain in their neck or their elbow or their knee. Or
Really?
so because the mechanics of the body were off. And every time they took a step, a body part was getting annoyed because that whole chain reaction that has to happen from the time you land on your heel till the time you push off your toe, it goes all the way up to the neck and all the way back down. And if there's anything interrupting the optimal function of the body with that action, it can create pain almost anywhere. Now, I'm not saying every single person with pain has ankle issues, but most people have a history of an ankle sprain, or at some point they were non weight bearing because of an injury or surgery
Yeah.
and they never restored that ankle function, and they didn't even know there was something wrong.
So, what surprises you the most when people become pain free?
Surprises me the most? Hmm. I'm not usually surprised because I know the strategies and the actions they're taking, and I know
Yeah.
they work because I've observed that for so many years. I think sometimes I get surprised at how people are shocked at the change in their life. And here's a good example. I recently did this beta program. I wanted to see, could we kind of fast track people getting out of pain? And we had a lot of what I lovingly call hot messes in this beta program, a dozen people. And, some of them weren't expecting really anything, but they kind of hoped. So they enrolled in the program. And one of them was adamant that nothing was going to work. January is her worst month of the year. February is even worse. She just expected to decline and have horrible months. Why did she even join this program? Well, because the encouragement, the support, and the expert guidance and the strategies she was taught to do and all, January ended up being her best month in years. And she was shocked. I mean, she almost couldn't believe it. Just her reaction was like, "Okay, I don't know what happened, but this was like my best month ever. I can now walk without pain. I can wear shoes I haven't been able to wear in years because her feet used to hurt her so badly." So, I mean, it was just yeah.
Wow.
I
Wow.
yeah,
Wow.
amazing,
So,
amazing.
you talk about, people aging without declining. At what age
Mhm.
does physical decline actually begin? Is it much earlier?
When we believe we're supposed to.
Yes. Yes.
Yeah.
What?
I've worked with people over 100 years old and gotten them stronger in parallel bars doing squats.
Wow. And were they doing some sort of exercise prior or no?
No, these were people who had declined in a nursing home setting, and they were required to have 2 assists for toileting. Now, the nursing home that I worked in was one of the best. It was the cleanest, the care was impeccable. But when you need 2 people to help you toilet, you're gonna wait a while before 2 aides have time to come and help you. So it radically alters the quality of the person's life because a lot of the times they can't wait as long as they need to wait.
Yes.
So so here's what happens. When you get them stronger and now they're a one-person assist, it shortens the time they need help and their quality of life goes crazy. I've had people in their 90s who I got them independent toileting in their room by strengthening them, and they were given approval to toilet independently and not even have to ring the bell. So,
So
I've worked with people in their 90s. I have one person in my academy she's in her mid-80s, and she has recovered so well that in her apartment building, she climbs 14 flights of stairs every day for exercise.
wow. Wow. So you're saying it's truly possible to rebuild strength and mobility
Yeah.
at any age.
Yeah.
So,
Yeah, the human body's designed to improve on a cellular level. Age does not inhibit that. You can increase the density of your bones in your 90s. You can get stronger in your 80s and your 90s. This whole thing of, oh, you can't put muscle on at a certain age, you know, can it be harder? Yes, because you don't know what to do and you don't know how to do it. And you've got this mindset that it's not even possible.
so what daily habits would you say quietly accelerate aging without people realizing it?
The doing less, I just spoke with someone yesterday, and he shared that he talked with his father, who happens to be my age. And his father said, "Oh, yeah, we're moving because we want a place with no stairs, because at our age, we don't want to use stairs anymore." That is one of the worst things you can do.
Yeah.
You need stairs. When you have no need to climb stairs, you lose the ability to climb stairs. You get weaker. I've got story after story after story of people who have declined because they moved to a place where they could age in place.
Yeah.
Again, that's a mindset. I'm going to decline. I'm not going to be able to do the stairs. So let me move where I don't have stairs. It's a circular pit of hell.
So you say about climbing stairs every day. Would that be, if you're no longer able to do so, that would be one of the earliest signs that someone is aging poorly before it becomes obvious?
Actually, one of the earliest signs is if you plop when you sit down. When people go to sit and they
Yes.
get their butt close to the seat and then they plop,
Yes. Yeah.
they've lost their power source ability to control that movement until their bottom is in the chair. And that is one of the quickest signs of weakness and decline. And it
Well,
has nothing to do with age.
yes. So also, how important is balance training for long-term independence?
Balance is impacted by a lot of things. It's impacted by posture. So when someone has that forward posture, it's going to impede their balance because you can't keep your balance if your body is out of alignment. And weakness, of course, is a huge factor as well. So, yeah, but you've got to address those issues.
Well,
You
but
know, just
can posture be corrected after years and
Oh,
decades?
absolutely. I've got some strategies I use. I had one guy in his 90s who, when he laid on the floor to do a rest assess before we did the work,
Yeah.
his head was so far forward. So if your head's way forward and you go to lay down, you're kind of doing this, trying to find the floor with your head because it's not able to be resting on the floor. He needed a pillow under his head. He couldn't lay on the floor without a pillow because it was so uncomfortable. And then I got him on the roller that I use. It's not ironing your body like a shirt. It's a very different technique. And we did 10 minutes of technique,
Yeah.
got him back on the floor, and he didn't need a pillow anymore. Now he was in his 90s. And
Wow.
in 10 minutes, we improved his posture.
Wow.
So the human body is so adaptable. It's
It
people have to know this stuff.
This is it. And that's why you're here, because education is key. So
Yes.
is there a connection between gut health and physical pain?
Yes. It's not always. People can have physical pain and not have a gut health issue, but the microbiome, has exploded with people writing books about it and articles and videos, and if you research on the internet, you're probably gonna be overwhelmed with the number of options to look at when you wanna find out about the microbiome. Well, my nutrition educator diploma did equip me with a lot of that information, and, it was a 900-hour program, and the issue is the foods that we're eating is what's disrupting our microbiome because you've got your good guys and your bad guys. You've got the beneficial and the pathogenic.
Yeah.
You're always going to have some bad guys in your gut. They're always going to live there. You're never going to be able to 100% eradicate them. But the point is, you want the good guys to outnumber the bad guys. And then what they do is they push the bad guy in a corner and they make him behave. So when you don't have enough good guys, the bad guys take over. So now you get yeast infections and you get strep throat, you get all this other stuff. And antibiotics wipe out everybody,
Right.
including the good guys, and then the bad guys can multiply and take over, especially if your diet is not feeding the good guys. And a
Yes.
lot of people, the standard diet is feeding the bad guys and starving the good guys.
Yes. Yes. So, and some people should be taking probiotics as well.
Yes, probiotics are a beautiful way to help to move forward in that. Unfortunately, there's a lot of products out there that are absolutely useless because they don't have enough concentration. They're not really efficacious. They're not viable. And then a lot of people don't know that you should take them with food because if you have an empty stomach, the acids are going to destroy what you're taking. It's not going to get where you need it. It needs to be living. They're fragile, so oxygen and light and temperature can kill it off. And now you're taking something that's dead. It's not going to help you. So there are some things that you do want to know. You don't want to be taking a prebiotic, which is kind of like a fertilizer for the good guys
Yes.
if you have what's called dysbiosis, if you don't have enough good and more bad, because it's gonna make you more gassy, more bloaty, more uncomfortable. But
Right.
the good thing about probiotics is there's never been an adverse event reported. They're safe to take from the time you enter the world till the time you go below ground.
Yes. Yes. Absolutely. So let's talk about your books for a second. Pain
Okay.
culprits and aging culprits challenge, and they may challenge some conventional beliefs, your books, but what inspired you to write them? And what truths did you feel people urgently needed to understand?
Yeah. So pain culprits was because so many people don't understand the connection. They are seen as a body part when they walk in the door. So even in my profession, people see a knee as a knee patient. Oh, we're going to do knee exercises. Well, that's completely off the mark because the knee is stuck between the hip and the ankle with no place to go.
Yeah.
And so if you've got the ankle history or you've got hip issues, the knee is not going to be happy, but you're going to be beating up the victim doing knee exercises, and the culprit is getting off scot free. And so you're not going to get anywhere. So that's why I wrote pain culprits. I've got a chapter in there on knees and back and hips and shoulders to teach people the connection. And so many people are like, oh my gosh, yeah. I mean, I talked with somebody yesterday who said, oh man, I had an ankle that I sprained years ago. I never made sure it's working right. I bet that's why my knee hurts. So people just, the light bulbs go off.
So
So
that's the biggest mindset shift that they walk away from, the
yes,
connection.
yes, you're a whole body, and you wanna make sure you're going after the culprit and not beating up the victim. And if
Yes.
you're sitting in an office with anyone and they only see you as a body part, they're gonna be very limited in how much they can help you.
So what are, in terms of in aging culprits, what are some of the most surprising culprits that quietly accelerate aging?
The biggest one, chapter 1, is mindset. If you believe you're supposed to decline, you're going to.
Yes.
If you
So
decide
if
to
you believe
reject the
that,
narrative
yeah.
yeah, yeah,
No, go ahead. Go ahead.
yeah. I have a whole chapter in there on incontinence. Believe it or not, it's not a rite of passage to need disposable underwear before you go below ground.
Yes.
Okay? And there are amazing exercises that you can do fully clothed and upright to restore pelvic floor function. And I've been teaching that for years. I teach it at the local college. So there's a lot of things that are blamed on our increased age. I've got chapters on pretty much all of them. bone health,
Yes.
posture, balance, incontinence, they're all in there. So, yeah.
I was gonna ask you if you could just tell us about one exercise that can help our viewers today.
Yes, absolutely. So, if somebody is sedentary and they do a lot of sitting, and when they go to stand up, if they feel pain in their low back, it's not because they have a back problem. It's because they've been sitting. So the front hips have locked short and those muscles attach to the lower spine. So those muscles don't want to get longer because they've been short for so long. And so they're going to kind of grab on the low back. So you think you've got a low back problem, but you've got a front hip problem. And then when you've been sitting for decades, I
Yes.
kind of lovingly say it's a pancake butt. You don't
Yeah.
really have nice glutes.
Right.
And so that's your power source. When you go to push open a heavy door, if you've got a weak power source, you think you've got weak arms. Got nothing to do with it. It's a weak power source because you got to push through the floor with the same force that heavy door requires to push it open. It's not your arms, it's max. So, my biggest thing is I tell people get up regularly throughout the day. I don't care even if you're watching a movie or you're reading a book or whatever, set your cell phone to go off at least once an hour. Or
Yeah.
if you're sitting at a job and you got a desk job or whatever. Now, if you're a bus driver, you might not be able to do this, cab driver, truck
Course.
driver, it depends. But the goal is you're going to stand up and you're going to release the front hips and you're going to put some power to max. And it's real simple. When you go to release the front hips, just bring your hips forward. Now, if that pulls on your low back, then what you want to do, it's kind of like pushing a drawer in to get it back on track before you
Yeah.
pull it out. So what you're going to do is you're going to bring your hips backward to sort of shorten those front hip muscles
I'm
and make
trying
them
while we're
happier.
speaking right now.
Yeah, yeah, yeah,
Yeah.
absolutely. So go a little back
Yeah.
before you go forward and only go forward enough so that you're feeling it open, but you're not causing pain.
So
You don't want to
I
be.
should be focused on my hips?
Yes, your
Okay.
hips.
All right.
Yeah. So, and you don't want to be punching the bear in the nose because your body thinks you're trying to hurt yourself and it wants to protect you from the pain. So it's going to force you to do weird things you don't even know you're doing. Like you'll side bend, you'll rotate, you'll do all this weird stuff
Yes.
and you'll be training in dysfunction. So this is not that no pain, no gain thing. This is that make sure the movements are successful, that you're competent, you're confident, and it feels good.
Yes.
That's what matters most. So now most people only move in one plane of motion. You want to do this in three planes of motion. So you just come forward with the hips, do that a few times to feel like you've loosened things up.
Yes.
And then you're going to do a little side to side, kind of like if you were in parallel bars and you're tapping them with your hips,
Yeah.
but you let your whole body be part of it. Just do a few of those.
Okay.
And then you can do a little rotation, just a little bit of turning. So you've just mobilized your hips, your pelvis, your knees, your ankles, and your trunk in three planes of motion
Wow.
in like a minute. And,
Wow.
and you do that every half hour, every hour. It's
Yeah.
phenomenal. And then if you want to improve max, especially if you're plopping, you got the chair behind you. Keep
Yeah.
your knees against the chair so you don't aggravate your knees. If you've got knee issues, you can put that one foot forward a little bit. You can spread your feet. You can turn toes out. Find a foot position that allows you to do this without aggravating your knees or pain. And then just pretend you're going to sit and get your butt as close to the chair as you can
Yeah.
and
I'm doing
stand
this
back
now, so if
up.
you see me going down, that's
Yeah, yeah, yeah. And just do that, give it 5, 6, 10 times. You've just now provided blood flow and you've engaged max. You've got your hamstrings getting longer and shorter under tension, so they're going
yeah,
to work better. You're going to find after a few days you're not plopping anymore.
exactly. This was
Yeah.
great.
And you might find going up and down stairs is easier. So,
Exactly. This is great. So
yeah.
listeners, take note.
Yes,
Okay,
yes.
I have a couple more questions because this has been a great interview. So, from your experience, Eileen, how does living with chronic pain impact a person's overall happiness and sense of purpose?
Oh, their world has shrunk. They've shrunk their lives into these small things that they allow themselves to do for fear of making it worse and trying to keep it from happening.
Would you say the two that they've given up on life?
A lot of the times, and it's not even their fault because they've been told, "Well, there's nothing else we can do for you. You're gonna have to learn to live with it, unless you want surgery," or most people, they'll even say, "Well, the surgery, we can't really guarantee it's gonna help." A lot of people, there's a neurosurgeon who teaches in a medical facility, and he's renowned, and he says that only 5% of the people with back pain actually need surgery. And 70% of the people who have low back pain, it's unknown cause. And it's because the trunk above's not working right or the hips below aren't working right. It's not even the back most of the time. So people are treating the back, but again, the back's the victim,
Yeah,
not the culprit.
yeah, yeah.
So, but if they've been told there's nothing else that can be done, yeah, they lose hope. Absolutely. And sometimes people think, well, I've tried everything. Well, unfortunately, there's not possible for anybody to try everything because this world is full of a lot of stuff. But the problem is they haven't come across the thing that's going to work. It
Yes.
doesn't mean they've tried everything and that life is hopeless. And what I've seen, and this is a really important point, over this 30 plus years, no matter how bad someone's situation is, there's always something that can make improvements. Always.
Always. I agree. Do you personally believe that physical strength and mobility are directly connected to emotional happiness and confidence as we age? And if so, how?
Absolutely. Fear of falling really impacts the quality of life of people. So if they're afraid to fall, they're like furniture hopping, holding on to stuff as they move. They see a big wide open space between their car and the shopping center, and they're kind of like, "Ooh, am I going to get there okay?" I mean, there's yeah, absolutely.
Oh, wow. Eileen, you have enlightened so many people today.
I
Thank
hope so.
you have.
Yes,
You really, really have. And you've reinforced the messaging that I know it's cliche to say this, but age is only a number. It
it
doesn't
is.
matter how old you are, it's your mindset that's key as well.
Mhm, mhm, and knowing the right things to do.
And knowing
Absolutely.
the right things to do with the right support. Don't give up.
Yes, yes. And that's why, there's so much human misery in the world because of mainstream understanding of things that's not accurate. And I wouldn't be able to sleep at night if I wasn't part of the solution. So that's why I do what I do. I mean, I've got my YouTube channel. I've got so much stuff out there that's free for people. So if they're limited resources, that won't stop them from learning good things.
So, Eileen, how can people contact you?
Probably because I've got a bunch of websites. I've got one for each of my books. I've got one for pain. I've got one for aging.
What about
The
your YouTube
best
channel?
It's just my name, Eileen Kopsaftis, which, it's a strange handle, but I'm sure you're gonna have that printed somewhere so
I
people will
will.
know it. But what I created, I have a main website called Have Lifelong Wellbeing, because that's what everybody wants, to have lifelong well-being. And so it's havelifelongwellbeing.com. And I created this little 5-question quiz. It takes literally less than 2 minutes to answer. And that will aim people at the resources, whether they're free, paid, whatever, that will address their concerns.
Okay, wonderful. Eileen Kopsaftis, thank you so much for joining us today. It was great.
Yeah.
Thank you so much.
Yes. Thank you for what you do.
Oh, thank you so much. I love doing what I'm doing. I love helping people. I love being of service, and I know we're
Yeah.
making a difference. We are.
Yes. Absolutely. It's not work when you love it.
It's not. It's really not. Thank you so much. Such a powerful conversation with Eileen, reminding us that living pain-free and aging well is more possible than we've been led to believe. Thank you so much, Eileen, for sharing your wisdom. And to everyone listening, please remember to like, subscribe, and share, and keep exploring your own different facets of happiness. I'm Jackie Denise. Thanks for joining.